Angina. Types of angina. So, angina means chest pain. It's a clinical manifestation of reversible myocardial ischemia. And myocardial ischemia mainly due to increased oxygen demand or decreased blood supply to the myocardial tissue. And myocardial ischemia that may be reversible in case of angina. There are different types of angina. We can see one by one. It includes stable angina, unstable angina, princemetal angina, post-infarction angina, angina decubitus, nocturnal angina, silent ischemia, microvascular angina, intractable or refractory angina. In stable angina, it refers to chest pain that occurs intermittently over a long period with the same pattern of onset, duration and intensity of symptoms. And the pain usually it's an unpleasant feeling, and the pain described as a constrictive, squeezing, heavy, choking or suffocating sensation. And the pain start as a burning sensation in the epigastric region, and it appears as a substernally. Then the sensation will be radiate to the neck, jaw, shoulders and arms. Pain usually lasts for only a few minutes, that is 3 to 5 minutes, and commonly subside when precipitating factor is relieved. And pain is at rest is unusual. So the stable angina, it mainly due to myocardial ischemia and usually associated with coronary artery disease, and episode is last within 5 to 15 minutes, and it is provoked by exertion. So there will be a precipitating factor for stable angina, and it is the stable angina increase when the patient is on exertion or on physical exercise. Then it is relieved by rest or with nitroglycerin. Second condition is unstable angina. Stable angina mainly due to atherosclerosis. There will be decreased blood supply. But in case of variant angina or princemetal angina, that is mainly due to spasm of the coronary artery. And it frequently occurs with the patient migraine. If the patient have the history of migraine, there is high risk for princemetal angina. And in case of Raynaud's disease, the patient is risk for princemetal angina or variant angina. And the coronary spasm that may occur with the presence or the absence of coronary artery disease. And this angina, it can be triggered by smoking, and this princemetal angina, it occurs at rest, and usually it can be treated with calcium channel blockers and nitrates. And the factors that stimulate coronary artery spasm is increased myocardial oxygen demand and increased levels of certain substance like histamine, prostaglandin, etc. And there will be ECG variation, that is ST segment elevation can be observed in case of princemetal angina. Another angina is unstable angina. In unstable angina, the patient will have the new onset of pain and it is not relieved by rest. And if it is worsened, it is an cardiac emergency and it may leads to myocardial infarction. And the unstable angina, it needs necessary or immediate action. And the chest pain that is new in onset occurs at rest and worsening pain, that is known as unstable angina. And the patient will have the fatigue, shortness of breath, indigestion and anxiety. And unstable angina mainly due to rupture of thickened plaque exposing thrombogenic surface. So mainly the unstable angina due to complicated lesion, and it is a new onset angina, and the angina have the increasing frequency, duration and severity. So if not treated unstable angina, the patient will leads to a complication. Then this angina, it occurs at rest with minimal exertion, and pain is not relieved by nitroglycerin. Instead of that, we can use morphine. Other types are silent ischemia. Silent ischemia that occurs usually with diabetic patients. It is mainly associated with diabetic neuropathy. And silent ischemia, it refers to ischemia that occurs in the absence of any subjective symptoms. The patient will not be exhibit any symptoms. Instead of that, when we are observing ECG, there will be ECG variations like ST depression. And here the main reason is diabetic neuropathy that affect the nerves that innervate the cardiovascular system. So the patients will not be able to identify the pain, and some patient may occur with pain or some may not have pain. So that is regarding the silent ischemia. Next one, nocturnal angina. Nocturnal angina occurs only at night, but not necessarily when the person is in the recumbent position or during sleep. So usually nocturnal angina that occurs at night. Next one, angina decubitus. Angina decubitus is chest pain that occurs only while the person is in lying position. Angina decubitus occurs only when the person is in lying position, and it is relieved by standing or sitting. Next one, post-infarction angina. Post-infarction angina means angina occurs after MI, and the recurrent episodes of myocardial decreased blood supply or myocardial ischemia that may leads to post-infarction angina. Next one, macrovascular angina. Microvascular angina. Microvascular angina means it can be more severe and last longer than other types of angina. Medicine may not relieve this type of angina. Microvascular angina or angina syndrome X is characterized by angina-like chest pain but have different causes. The causes of microvascular angina is unknown. So microvascular angina means the main cause is unknown, but the symptoms it is not relieved by rest, and medicine also have limited role in microvascular angina, and the symptoms will be more severe. Next one, intractable or refractory angina. Intractable or refractory angina means severe incapacitating chest pain occurs during myocardial ischemia. So that is intractable or refractory angina. So the patient feel severe incapacitating or refractory angina will experienced by patient, and it is not relieved by medicines. That type of angina is known as intractable or refractory angina. So the types of angina that includes stable angina, Prinzmetal angina or variant angina or unstable angina, silent ischemia, nocturnal angina, angina decubitus, post-infarction angina, microvascular angina and intractable angina. Thank you.